now filming this, so I cannot go and participate in the surgery. Assalamu alaikum. Today I will take you on a brief tour of our internship hospital, the first affiliated hospital of Hainan Medical University. We will explore areas from the outpatient department to the surgery building, and if time permits, I will show you other departments as well, and some BTS in the surgery building involving patients. Let's explore the world of healthcare together. We are starting here at the outpatient department. This is where patients come for consultations, follow-up visits, and minor treatments, etc. It is the first stop in patient journey. We have entered the OPD now. Currently, we are standing in the registration area where patients and their relatives patiently wait for their turn to register and see the doctor. As you can see, there is a line of people all patiently waiting to register and collect their tickets. This kind of process helps organize the flow of patients, ensuring everyone receives the attention they need in a systemic and efficient manner. This is a place filled with hope, care, and sometimes a little nervousness. The OPD is vital because it helps diagnose and manage health issues early on. The doctors here in this outpatient department listen carefully to patients' complaints, examine them, and then decide on the next step. And right here on the elevator side, we have a helpful board here you can see displaying the different departments and floors of the OPD. Each floor is dedicated to a specific specialty, whether it is cardiology, orthopedics, pediatrics, gynecology, or others. This guide makes it easy for patients and visitors to quickly find their way and know exactly where to go for their medical needs. Now let's head to the surgery building, the place where life-changing procedures happen. We entered through the staff elevator. When entering into the surgical area, we first need to change into a proper attire for sterility. The surgery area door is open. Now we need to sit here and remove our shoes first, then walk along this wooden line on the floor to pick up the surgical shoes and put them on. After entering into the surgical area, you need to take your scrubs. This include the surgical cap and the surgical mask, and then change and put onto these scrubs before entering into the surgical rooms. Here to change. After you enter into the dressing room, you find your own cupboard and open it and put your own belongings. Like that, you put your belongings inside. I am in the main dressing room. I need to change and put on these scrubs before entering into the operating rooms. Time to change now. Now that I am in my surgical attires, I am ready to enter into the surgical area. Maintaining this sterile protocol is essential for patient safety. First, as you can see here, since I am filming this now, I won't be doing it myself, but observe our surgeon washing his hands properly. After that, he will go into the operating room and put on the surgical gown and gloves, ensuring everything remains sterile. This process helps prevent infection and maintains a sterile environment for the surgical procedures. This is inside one of the operating rooms. Everything here is sterile and carefully organized to prevent infection. Now let's go and check some anesthesia procedures and anesthesia machines. You see, when I entered this operating room, the anesthesia had already been administered, but let me share some important information about the anesthesia machines here. You can see here the anesthesia machines. These machines deliver gases and medications that help keep the patient unconscious and pain-free during surgery. It is a complex process involving continuous monitoring of the vital signs like the heart rate, oxygen level, and blood pressure. Here you can see. I'm now filming this, so I cannot go and participate in the surgery because I need to wash my hand, wear onto the surgical gown before performing surgery. So you can see from a little bit far away. This is one of the operating rooms. Here you can see, when you see Shu Jong, meaning that surgery is going on in the room. You can see here from this little screen here, you can see the surgery that is going on inside. And when you want to enter, we don't need to put our hand or something. You just use your legs like that. And then the door will open. When the door opens like that, and then you enter. This is like the study room or conference room in the surgery area. You can name it like that. This is where we come and study or have a meeting sometime. Or if there is teacher here want to teach something to internship student, we come here and sit here, and the teacher will teach us whatever she's going to teach us. And after that, we will head to the operating rooms. That is all for this surgery area. Now I am going to take you to other departments to see some few things, and then we will call it a day. I am out of the surgery building now. I wanted to take you to other departments to see many more things, but fortunately now it is time for Juma, almost time for Juma now. I need to hurry up. So hopefully in other time I will take you to other departments as well. That is a brief tour of our internship hospital today. You have seen the teamwork, technology, dedication that go into patient care. I hope you enjoyed this little trip, and remember, it is more than just medicine. It is about saving lives and making difference. That is all for today. See you tomorrow.